Good morning.
Hello.
How are we going? We all good? Okay. Good morning, Queensland. I can report today that we have 22 confirmed new cases of COVID in Queensland. 18 of these cases have been infectious in the community. 2 have been detected in home quarantine and 2 in hotel quarantine with overseas travel. Those detected in the community are located in Brisbane South, Brisbane North, Darling Downs, Gold Coast, Sunshine Coast, Townsville, West Moreton and Wide Bay regions. Most of those people have been infectious in the community between 1 and 7 days. The source of the virus for the majority of those people is primarily interstate travel, but some, of course, are overseas as well. We have 67 active cases now. We've had 11,707 tests over the last 24 hours and 17,452 vaccinations administered by Queensland Health yesterday. And that shows that we are seeing an increase in people coming forward for their boosters, which is fantastic, but also a good number of people coming forward for their first doses. We're seeing about a 0.2% increase each day, which is fantastic because we are getting closer to 90% first dose, which means we will get to that 90% double dose sometime in January. That puts us at 88.82% first doses and 82.56% fully vaccinated for 16 and above. So thank you, Queenslanders. Keep coming out and getting vaccinated. A job well done. I can also advise that one of the positive cases, that person was a visitor at an aged care facility and has since tested positive. That aged care facility is in Holland Park and there are measures being taken right now to test the staff and the residents of that aged care facility. I can also advise that we now have some results back on our genome sequencing and we have identified 3 Omicron cases here in Queensland. One is the Townsville gentleman who had been on those 2 flights that we had listed as exposure sites. Thankfully, this person has had very limited exposure beyond those flights and the airport. The other one is a female from Rochdale South, who we have previously reported had been in Newcastle. She was infectious in the community in Queensland on the 12th and 13th of December. And the third one is an international aircrew who has not been out in the community. Of course, we need to assume, and we are expecting more Omicron cases to come forward. We know that this virus is rapidly escalating. It is spreading far quicker than Delta, and we're seeing that from interstate numbers as well. And of course, what we're seeing in the United Kingdom particularly. I can advise that we have given out 61,189 of the GV border passes. So that's over 61,000 people who have got border passes to come from a hotspot into Queensland. So as we said, with all of these people coming from interstate, we can expect more cases. That's exactly what we're reporting today. We expect these numbers will keep growing. I'm very pleased that all of the people who have travelled from interstate are fully vaccinated, that are positive cases. And that means that these people are not showing signs of being seriously unwell. And it is all about not the number of cases we have, but the number of people that end up in our hospitals and our ICUs. That is absolutely critical, and why we are doing what we can to manage this virus and do it in a sensible and responsible way, which is why we have put the measures in place that we have thus far. So we've said this before and we'll say it again. Unvaccinated people have a much higher chance of contracting this virus and becoming seriously unwell and in hospital and in ICU. So we need people to come out and get vaccinated to protect themselves and their loved ones. And if you are fully vaccinated and eligible for your booster, please come forward. The other message for all Queenslanders today is with these cases, we can see that this virus is popping up everywhere. There is nowhere in Queensland where you can hide from this virus. And that is why I'm stating to everyone today, now is the time to carry your mask and to start wearing that mask. You should be wearing this mask whenever you are in heavily populated indoor areas like retail shopping centres, on public transport, and of course high-risk settings like hospitals and aged care facilities. So please, get out those masks, start wearing them anywhere in Queensland, just to protect yourself and also reduce the risk of the spread of this virus and slow down the spread, because that's what we're doing now. The cases will come, it's about slowing down the spread, and we can do that with masks as well as getting vaccinated. Of course, make sure you continue to come out and get tested if you have any symptoms, and also making sure that you are checking in. We ask people, again, no matter where you are in Queensland, we will constantly be updating in real time our website on exposure sites. So please be looking at least daily at the COVID website to see if there are any exposure sites in your local community and whether you've been to any of those exposure sites, and follow the guidance that the website gives and the public health units give. Looking at New South Wales and Victoria's figures today is a stark reminder why we have put the measures in place that we have. The fully vaccinated requirements for interstate travellers from hotspots and the negative PCR test, and of course why we're bringing in the measures from tomorrow around mandatory vaccination for patrons and staff at certain venues, being pubs and clubs and hotels and other high-risk settings. So please carry your mask, get tested, check in and vaccinate. We know we can manage this. We've done it before. We know what's coming. We know how to do it. Please, Queenslanders, we know you can step up and support all the things that we need you to do so that everyone can have a Merry Christmas and spend time with family and friends. I'll now hand over to the Chief Health Officer to just talk a bit more about these cases today. Thank you.
So, as the Minister has told us, we are seeing increasing numbers of cases across the state, and this is exactly what we expected, and this is what we expect to continue to happen. The details on these will become increasingly complex, and as time goes by, we will change the way in which we present the data. What I want to say, though, is we've had 12 of the cases mentioned by the Minister were linked to interstate travel, all fully vaccinated. One case was detected on the community, locally acquired, and at this stage we have not identified a link for that particular patient. 2 cases are known contacts of another case or cluster, one on the Gold Coast and one in the Darling Downs region. One was vaccinated and one was partially vaccinated. We've got one patient who was potentially infectious for 3 days, but there's contact tracing proceeding. 3 cases are linked to overseas travel and detected in quarantine, one in home quarantine and 2 in hotel quarantine. One with travel from Doha, 2 with travel from Africa. We have 4 cases as of this morning still under investigation. The Minister mentioned that we have identified 3 Omicron strains overnight, one in the Townsville patient mentioned yesterday, one in the South Brisbane patient, and another flight attendant who was identified in hotel quarantine. And I can tell you that we are identifying additional cases of Omicron hour by hour, so there'll be more cases tomorrow. The single most important thing, of course, is to get vaccinated. We want people to start wearing masks indoors, in public transport. What we are aiming to do is to try and slow the spread of this virus, to give people an opportunity to particularly to get the 3rd dose of vaccine. Some of the people who are now eligible for the 3rd dose of vaccine are among our most vulnerable and include healthcare workers. We want to slow the spread of this virus to give these people an opportunity to get their third dose. We know we are not going to stop this virus from spreading. On some positive note, and it's only a small positive note, I have spoken to every doctor that's looked after the patients with the Omicron virus. All of these have been vaccinated, and for what it's worth, all of these patients are well. They're not sick at all, having been vaccinated. Now, they're small numbers. We obviously need to see larger numbers, and we need to see what happens in people who are vulnerable and older. And I think I'll leave it at that this morning. No, yes, the numbers are small. These patients are young. They've been vaccinated, but yes, it's positive. It certainly is positive. And I'm contacting every doctor who sees one of these cases just to get some idea of what they're like. Obviously, New South Wales will have a lot more experience on this soon and will be able to tell us more from there. The early data from South Africa we've heard suggests that it might be a little milder, but we can't work on that assumption. We still have to treat this virus seriously, that the Omicron strain very seriously. We do know that some people do get sick, but it'll be some weeks before we get good, solid clinical data from large numbers of people. At the ones we've seen here in Queensland, mild indeed. Most have had no symptoms. Most of do we have the numbers here? The patients we are treating in hospital are all there for quarantine purposes because of the current Queensland guidelines. I am not aware of any significantly unwell patient in hospital at the moment. Certainly there are none in intensive care at the moment.
At what point would you consider reintroducing a mask mandate? You're using pretty strong language now around encouraging people to wear masks in those crowded situations. Why not make a mandate?
This is a very active discussion.
So we could see a mask mandate sometime later.
It's a very active discussion.
It's a bit strange that all these people came up from Melbourne and Sydney where they had been wearing masks, then they come to Queensland and take the mask off and are mixing in the community.
Well, we know in New South Wales and Victoria there are large numbers of people with COVID-19. We know in northern New South Wales there are very large numbers of patients with COVID-19, although the vast majority who are vaccinated are not particularly unwell or have no symptoms at all. So in fairness to them, they often don't know that they're carrying it and are surprised when they get a positive result.
It's a bit strange coming up to Queensland and then not needing masks.
We are actively looking at the mask issue at the moment. Well, we know that patients can spread up to 14 days, but as you would be aware, from the 1st of January, we are going to be changing our guidelines.
And what does define a close contact? There's been a lot of different definitions for different jurisdictions. In Queensland, what is the definition of a close contact?
The definition, there is no simple definition. We have experts in the field, doctors and nurses, who look at these issues on a case-by-case basis. It depends on the time they're with the patient, the environment at which they are with the patient. It's not a simple one or two-line answer.
But for example, though, you've been putting up contact tracing sites like shopping centres and things like that. If someone was in the vicinity of one of those places at the exact same time that a person with COVID was there, would they be considered a close contact? What sort of
Usually a close contact is considered someone who's been face-to-face for 15 minutes or so. That's the typical definition of a close contact. No, that's not on the agenda.
Just in terms of the booster, if people want to get a booster, how quickly can they get one?
At the moment there is availability, so there is capacity across the field, I understand. So GPs, pharmacies and the state centres.
And just a bit of clarity on the wait time, how many months is it?
5 months. So 5 months from your second dose. 5 months from your second dose.
Okay.
So in that first 5 months, you have good immunity, but it starts to wane after about 5 months, and then when you get that third dose, your immunity really skyrockets.
How concerned are you about the growing number of hospitalisations, particularly in New South Wales?
The numbers of hospitalisations are still not grown to huge numbers in New South Wales, but obviously we're concerned. Obviously we're concerned. We're expecting this surge of the virus to occur within weeks here in Queensland.
This is the start. I think you accepted yesterday that it would spread weeks, not necessarily months.
Yes.
At what point did it become unnecessary to keep the measures in place, like making sure people don't get scarred when clearly it's spreading uncontrolled?
We review each of these measures on a daily basis, and one by one we are relaxing them. We don't want to have a Freedom Day as they did in the UK, where it was clearly a mistake. We are relaxing measures one by one over a period of time. We don't want to have a surge such that will A, overwhelm the hospitals, and B, not allow the vulnerable enough time to get their third dose of the vaccine.
And when you look to now ramp up some of the testing sites, I think some of them drifted offline as the cases came down. Now we're hearing places like Fraser Island, you basically know where to be placed on Fraser Island. As the cases do spread, do we need to increase the number of places that people can get tested?
There is some active work being done on the testing sites as we speak. We've had discussions this morning about that process.
So they will increase.
There is an active discussion among both the private sector and the public sector on this issue.
The modelling from New South Wales indicates that they could see up to 25,000 cases a day in January. What does our modelling show?
We are currently working on that modelling, but we're expecting many cases.
When we see any fatal cases, if so, when?
Oh yes, I think it's likely we will see fatal cases, particularly among the unvaccinated, and that would be such a tragedy if someone is watching this now and they're unvaccinated and they die in 3 months' time. What a tragedy!
When we get to that,
Queensland's got one of the lowest vaccination rates.
The hesitancy in Queensland is melting away. You can see people getting vaccinated every day. The numbers are climbing, and I think as we see more cases, I think we'll see it melt away even further.
What sort of preparations are in place for outbreaks in areas where there's not necessarily vaccination? We have teams going in.
Every day. We have teams going in every day. The two Deputy Directors General have been travelling the state looking at these areas. I think our Minister was recently looking at vulnerable areas. So all the time this is being looked at.
When it gets to the point of thousands of cases per day, will exposure sites continue to be uploaded by Queensland Health? Do we have enough staff to do that?
Almost certainly not, but we haven't got to that point yet. But as time goes by, yes, you're quite right. It would sound like that.
Still being treated, you mentioned it. Are they still in hospital, all cases at the moment? And when will we transition to more adult?
Again, a very active discussion at this very minute, which we're likely to transition sometime in the very near future. The Director General was meeting this morning with a number of key players on this subject, including the private sector, and my understanding, and the Minister may be able to help me here, that the capacity is being increased substantially to deal with those numbers.
Yeah, sure. So the figures I was given this morning is we are probably looking at around 50,000 tests over about a 3 to 4 day period, based on the number of people who have had border passes over the last few days, assuming they all entered when they said they were going to, but I would expect around 50,000. So, we know that during the Indooroopilly cluster, we were doing some days there 30,000 a day. Remembering this 50,000 is spread all over the state. In some ways that assists us because it's not in one concentrated area. But as one of the questions before, it also creates other issues about more remote communities where people may be holidaying. And I did say before that if someone's on an island, for example, and they hit day 5, we've made sure that the Public Health Directive allows for them to be tested at the next convenient available time. So if they're on that island for 7 days and there isn't testing capacity, as soon as they come off, to get tested, because they're not being tested because they're a close contact. They are being tested as just an extra element we've put in to try to reduce the risk. Yeah, well, we have to. we just have to make sure that we've got that testing capability, because testing, put aside the people coming from interstate, as we get more outbreaks, as we get more exposure sites and close contacts, inevitably thousands of people will be coming out. I had a look at New South Wales and Victoria's figures this morning. I think it was Victoria that did New South Wales, did 104,000, over 104,000 tests in the last 24 hours. So we have to expect that we're going to get the same sort of levels of testing. I think Victoria was over 77,000. So we have to be prepared for that. We've been planning for that. We'll continue to work with the private sector as well, remembering we're going to see our surge as we go through the holiday period, when we have the most number of people travelling around the state, coming into the state to holiday, big gatherings. So we need to make sure we've got those capabilities right through Christmas.
There's no compliance for, how are we going to make sure that people are having this test on day 5?
So, yeah,
it's a lot of people.
it is a lot of people, and with everything we have done from day one, this is about trusting in the people doing the right thing. We can do audits, and we will do random audits, because we can pull out anyone from the border pass system and check whether they've gone and got a test. So we can cross-check and we can do audits. It is a public health directive, so it is lawfully binding on people. I have every confidence people will do the right things, just as they did. Remember, we had tens of thousands of people in home quarantine required to get tested on day 1, 5 and 12 over the past 12 months, and those people have complied. We've had such an amazing level of compliance. But even when people get a negative test, we've got to remember that they can end up positive at some later stage, or they could end up contracting the virus while they're here in Queensland. It won't just be transmitting it from interstate. We'll start seeing community transmission happening in Queensland very soon. I think 61,000 border passes says people are absolutely coming to Queensland, and they're coming quickly, and we expect that number to keep growing every day. Well, look, every state has some form of quarantining. Every single state has some form of quarantining when you are a close contact. So to say that it's a disincentive for Queensland to have quarantine requirements, no. It doesn't matter where you're travelling in Australia. If you become a close contact, you're more than likely going to have a quarantine period. Now, whether it's 7 or 14 days, that will mean someone who's in quarantine may end up missing out on very special occasions, including Christmas Day. Even if we were to change to 7 days right now, there will be people who will become close contacts on Monday and Tuesday and Wednesday next week who will all miss out on being able to be with loved ones on Christmas Day because they're in quarantine. But we've got to do this safely. We are not New South Wales and Victoria. We don't want to be in their situation. Combined, they've had over 200,000 cases since the 16th of June. 200,000 cases. That is extraordinary. Hundreds of deaths, and Victoria has over 120 people in ICU today with COVID, or recovering from COVID. So we have to do this in a safe, responsible way. The virus is coming into Queensland, but we're going to decide how it comes in, how quickly.
Compliance. With regards to the mandate on Friday, there's been quite a number of businesses that have come out themselves and saying they're not going to refuse it. Can those businesses expect to be...
I have no doubt the Queensland Police Service are aware of all of those social media posts and businesses who are putting signs on their front door saying we're not going to comply. I mean, this is about keeping our community safe. A business who is allowing unvaccinated people in, or unvaccinated workers to operate in their business during a heavy Christmas period. We are about to go into our busiest season. We've got thousands of holidays coming into Queensland. We've got big family gatherings for Christmas and New Year's Eve. If you are a business who are allowing unvaccinated people to move around that business, you are much more likely to have an outbreak. You are much more likely to have your staff going into quarantine. So I don't know how that makes good business sense. Surely you want to reduce the risk so your business isn't having to have staff in quarantine.
Minister, there's still low vaccination rates in some Indigenous communities. Are those communities equipped to handle an outbreak?
Look, we are doing everything we can to work with the communities. I met with Quake and IUI, so Institute of Urban Indigenous Health, again in the last few days. The Deputy Chief Health Officers are up in the Cape and Torres again this week. We are working really closely with these communities, both in their capacity to test, to vaccinate and to look after any positive cases. But the most important thing for us right now is getting those vaccination rates up in those communities. And I know that our First Nations people are working hand in hand with us. I know a lot of the elders are out there talking about how they've vaccinated and why it's important that their people get vaccinated. And we need this to happen as soon as possible. We are seeing First Nations vaccination rates go up quicker than our general population vaccination rates at the moment. So that's a good thing, but we still need many more coming out and getting vaccinated. Not that I'm aware of, no. It's still on track. I believe it's due to come online, at least part of it, by the end of this month. So as far as I know, it's still on track.
Will that then take place in all hotels?
Look, we're working through all that. It'll depend on numbers. And of course there's changes. I mean, there was talk about PCR tests and people coming from interstate. We've already outlined the plan that says that 90% people coming from interstate hotspots won't have to do a PCR test. So the sooner we get to 90% double dose, the sooner we will have even less restrictions again on people coming into Queensland. But we're working through. We want to use Wellcamp to its full extent because we know that it's far safer than hotel quarantine. No, it's never flip-flop. The plan is there. It's publicly available. It's been on the website. That is in the plan, and the Premier said our plan has not changed.
So hotels would still be being used for Wellcamp?
It'll all depend on the capacity, the volume of people coming in, and also we're working through what cohort we want to put into Wellcamp. And we know that Wellcamp is a far better environment than our hotel quarantine because we know of the risk, and especially when we get Omicron becoming the dominant strain, that we're seeing that transmission internationally again through corridors. So the sooner we can get to Wellcamp, the better.
Minister, just one more on the vaccine mandate. Will there be more police groups on the ground, and what is your message to the
Look, the rules are there. They are lawfully binding, and the Police Commissioner said the other day that they will have police out there checking proactively, but also responding to any complaints from businesses. But the message is this. Okay, can someone please get that photo
I'll
up?
deal with that.
This shows how controlled I can be. I don't like huntsmen, but I'm going to keep going and I'm going to pretend I don't have a huntsman on me right now and let someone else manage this, but if it gets anywhere near my face, please let me know. I've got the Cho coming to help me.
Still there?
Where is it? Under your left foot.
Oh, I think I can see it. There it is.
Sorry, he's wandered off. Okay, well that was a moment, wasn't it? We've got COVID and we've got huntsmen. So the question, the issue about the mandatory vaccination on businesses, the message is clear, and I just said it a minute ago. This is about keeping communities safe. Is he coming back?
No, I can see it.
Everyone's looking at me at the moment. This is about keeping our community safe. Businesses are worried that as more cases come into Queensland, that they're going to have staff having to quarantine for lengthy periods of time, and that will impact on the business. There is one thing businesses can do to reduce that risk, and that is staff being vaccinated and patrons being vaccinated. So, at the end of the day, it is up to you as a business. Do you want to reduce your risks or not? And do you want to give confidence and safety to your patrons by complying with this direction? And also saying to all those people who have done the right thing, remember it's almost 90% of Queenslanders have already had one dose. saying that you value the choice they've made to get vaccinated and you're going to do what you can to protect them in your business. Yes. Oh, look, I understand they did some projections simply based on the rate in which they're seeing increases of cases right now. But look, at the end of the day, case numbers are going to increase. We know Omicron is more infectious. We know so far that if you are fully vaccinated, you are less likely to end up in hospital. Those are the facts. That's all you need to know. Vaccinations reduce the risk of you ending up in hospital. And all of the positive cases we have announced in the last few days, where they've been fully vaccinated, have shown they're not needing hospitalisation because they're seriously unwell. So all of the evidence speaks for themselves. People can look up whatever they want on social media, but ultimately the evidence is right in front of us. People who are fully vaccinated are not ending up in our hospitals and in ICU in large numbers. It significantly reduces the risk. So go get vaccinated. I don't have the stats. I'm not aware of anyone turning up who haven't complied with the vaccination or the tests. What we're hearing from the police is people just not taking the time to just make sure the border pass they're applying for is the right border pass. So if they just slow down a little, look at every question and make sure you're answering that question correctly, and it will take you to the correct border pass you need. And that way, you'll be able to get on your way and enjoy Christmas in Queensland much quicker. Thank you.
You're really good.